All right, let's get started. Thank you everyone for joining us for our kickoff call, our first Advocacy Institute of the year. We're super thrilled you're here to join us. It's a new year, it's a new Congress, we have lots of new issues to work on, but what's not new is our commitment to really pushing public policy to improve the lives of people living with neuromuscular diseases. So we're super excited you're here to join us today. We have a lot of great content to share. So we're going to get right to it. My name is Mark Fisher. I'm the Director of Advocacy Engagement. And again, welcome to our first Advocacy Institute webinar of the year. So first, we're going to go ahead and meet the team, just so you know who we are here in advocacy. Maybe some of you they know our few new faces we have. So we just want to make sure that you know who is here for you. We will then go over our 2022 accomplishments real quick. Quite a bit actually happened right up to the holiday. So we want to make sure you knew what was accomplished because of all the hustle and bustle of that season, you might have missed it. And we accomplished a lot with your help. So we want to make sure you know that. We then want to go into our 2023 advocacy priorities, what we're going to be advocating on this year. We want to then let you know, our amazing advocates, how you can help out. And as I'm looking through the list here, so many great advocates on the call. Many of you have joined us for our Hill Day last year, so it's great to see many of you back with us. So we'll let you know how you can help out. And then we'll give you that first opportunity to, in fact, take action with us. And then we'll have question and answer. So just a few housekeeping items. First, if you need closed captioning, you can find that in the lower left-hand side of the screen. Just click that button and it should pop up right for you. We encourage questions and answers throughout the entire time. So if you have a question, feel free to put it in the chat box. We are reviewing it the whole time. To access the chat box, just click those three little dots next to the chat button, and then a pop-up window will come up and you can get Q&A from there. So again, those three little dots next to the chat box, a window will pop up and you can put your Q&A in there. And that's how we can answer some of your questions. All right. Now, without further ado, let's go ahead and meet the team. So first, again, my name is Mark Fisher. I'm the Director of Advocacy Engagement. We'll also hopefully be joined by Sean Hill, who is our Manager of Public Policy and Advocacy. She's going to hop on as soon as she can. And then from there, I'll let Joel introduce himself. Joel.
Hi, everybody. My name is Joel Kartner. I'm Director of Access Policy here at MDA. So I handle all things access to devices, drugs once they come to market, physicians, insurance, and things of that nature. And I'll pass it back to you, Mark.
Excellent. Thanks, Joel. Michael, why don't you go say hello?
Hey folks, my name is Michael Lewis. I'm the Director of Disability Policy and I lead all of our advocacy efforts related to employment, education, accessible travel, especially accessible air travel, and leisure. So happy to be here and Happy New Year.
Thanks, Michael. And then Paul, round it out for us.
All right, well, good evening or afternoon, everybody. This is Paul Melmeyer. I'm the Vice President of Public Policy and Advocacy, leading the team here, and absolutely thrilled to have you with us for our very first Advocacy Institute of the year. So why don't we move along from here now that you've met the team. Just as a bit of a reminder, right? I know that some of you have been with us for a little while now. So generally speaking, you know what we do here in MDA's advocacy and public policy effort. But perhaps there are some of you that are new, or perhaps also it's been a little bit since you joined us. So with that in mind, we wanted to just start with a bit of a baseline on where we advocate and why. So really, we have three pillars within MDA's advocacy department, three areas in which most of the policies, pretty much all of the policies, frankly, that we get involved in advocating for the community fall within one of these three areas. So the first is in access to care. That's where we advocate for greater access to any kind of healthcare the community may need. It might be medical devices, might be a new treatment approved by FDA, or perhaps it is specialists or occupational or physical therapists or dietitians, whatever it happens to be that you or the community member might need for your health. We're advocating for you to be able to access it. From there, we also advocate on accelerating therapeutic development, in which we try to ensure any new technologies that could potentially treat a neuromuscular disease are making their way through the Food and Drug Administration, and hopefully from there will be approved and then available to the community. So everything we do in trying to ensure clinical trials run smoothly and are equitable and are accessible to our community, as well as from there FDA's review process to ensure that FDA is operating appropriately, that falls really within our second buckets or our second pillar of accelerating therapeutic development. And then our third is empowerment and independence. And this is where we try to break down those societal barriers that are in front of folks with neuromuscular disabilities, because we know that there have been so many barriers that are placed in front of those with disabilities, including accessibility-oriented barriers and travel barriers. This also includes barriers to obtaining employment or the job that an individual within our community may desire, barriers to education, and then barriers to benefits and other federal programs that we know to be important to our community. So really within these three areas, these three pillars of advocacy, this is where we focus, and this is really where we know and we hear from you. You want us to be focusing in, generally speaking, when it comes to our team serving the community. So let's move ahead and let's talk just a little bit about last year, because frankly there was a lot that we got done last year, and I want to just spend maybe 2 minutes on this, because really, again, this webinar here this evening, we're really focusing on this year. We're looking ahead, what we're doing in 2023, but still I just want to spend a minute or two looking back towards 2022 and what we all accomplished together. And when I say together, I truly mean that, because we wouldn't have been able to do much of any of this if it hadn't been for your voice really leading the charge up to Capitol Hill or to regulatory agencies or wherever we were taking the neuromuscular disease voice. So first, within our access to care pillar, we were able to expand newborn screening in a variety of states, newborn screening for Pompe disease and spinal muscular atrophy. In fact, Mark, if we could actually just skip, I believe, to the next slide, which shows the map of where we were at the end of 2021 and then where we actually are today. Look how much more colorful that map is on the right side of your screen, of states that are screening for both Pompe disease and spinal muscular atrophy, which is really exciting. Some states screening for one or the other, but still only 2 states there, Nevada and Hawaii, that are not screening for either one, whereas the year prior you can see many more than that. So we can go back to that to the victory slide, because not only were we able to expand screening for these 2 conditions in the states, we're also able to invest in the program more generally, adding millions of dollars going to the federal agencies that work on newborn screening and assist states within their newborn screening programs. And for those of you perhaps who are hearing about newborn screening for the first time, this is the program, the public health program, for which all babies born in the U.S. are screened for these conditions at birth, and if caught early, treatment interventions can be supplied, and actually some of the most damaging experiences of these conditions can be avoided. Also within access to care, we were able to, through the Inflation Reduction Act passed last year, obtain some really exciting prescription drug affordability wins, including an out-of-pocket cap on Medicare Part D. So for those of you who may participate within the Medicare program, no longer do you have to worry about Medicare Part D expenses going on in perpetuity. Now there's a hard out-of-pocket cap for expenses in Part D, which is actually the first time that's ever happened within the Medicare program before. At the very end of last year, we were able to extend some of the flexibilities in obtaining telehealth that have existed throughout the pandemic for an additional 2 years, I believe it is, which will allow for our community to still access their clinicians and other specialists from the home if they so choose. Also, additional investments in other key government programs, as well as obtaining officially the diagnostic codes for the limb-girdle muscular dystrophies, codes that did not exist prior to last year, and otherwise those with LGMD were being coded as an other muscular dystrophy, which, as you can just hear, is very imprecise. Moving on to our victories within our accelerating therapeutic development area, again, we were able to obtain much together, including a whole suite of reforms to how the FDA operates and how clinical trials are regulated by actually a law that was passed both in September and then another law that was passed in December. And this includes clinical trial diversity requirements, changes to expedited approval pathways, new opportunities for FDA or for patients to participate in FDA's programming. So all things that are going to be really substantial and really fantastic for therapeutic development for the neuromuscular disease patient community. We continued to implement the Act for ALS. In fact, we obtained $100 million in appropriations for the ALS expanded access grants program at the NIH and an additional $10 million for new research within rare neurodegenerative diseases that FDA will be administering. And then even just beyond there, additional dollars at the NIH for rare disease research and gene therapy oriented research and neurological disease research. Same with the FDA, same with other research endeavors for that matter. So lots of exciting things happening within accelerating therapeutic development. Finally, within empowerment and independence, our third pillar, we got a bill passed. We got the Able Age Adjustment Act passed. And this again was driven by your calls, your emails, your contacts with your senators and representatives at the end of last year, as this bill passed at the very end of the year. And this will extend the tax deferred accounts called ABLE accounts, in which individuals with disabilities are able to, in a tax deferred manner, put money away for the future in which they may have disability related expenses, do all that pre-tax. The eligibility for taking advantage of those accounts was expanded. Previously, it was 26 years and younger. The qualifying disability had to appear. That year is now 46 years and younger. So anybody within the ages of 26 and 46 will actually be able to now take advantage of these accounts if they have a qualifying disability. And then within accessible air travel, we saw the Department of Transportation not only hold some public meetings in which the community really showed up and talked about how the indignity of inaccessible air travel, but also some proposed rules that are now percolating that we're hoping will be finalized soon, coming into next year, or coming into later this year, I should say, all the continuing the momentum towards making air travel truly accessible. So as you can hear, a lot happened last year. I'm out of breath just trying to go through it all, and frankly, I could have spent an hour on this. But again, tonight we're not talking about last year. We're talking about this year and everything we're going to be doing together. So why don't we move 2 slides forward? Let's go past our newborn screening map. We already covered that. And let's talk about just a bit about this year, because we have a new Congress. We have a new Congress that has a new makeup of Republicans versus Democrats. And actually, before I continue, I just want to be sure I'm not stepping on anybody's toes. Mark, am I continuing along? Because I can get on a roll here. I just want to be sure that's the case.
Oh, yep, keep going.
Okay. Mark's been instrumental in putting slides such as this together. I just want to be sure I wasn't stealing his thunder here. So, Mark, thanks for the thumbs up. Okay, so primer on our Congress that we're in, and for those of you who follow Congress, you know it's been rather dramatic for the first couple of weeks, and it may be less dramatic from here. We'll have to see. But what we do know is that we have a new makeup in the House. Whereas on last Congress, we had Democrats making up the majority in the House, now we have Republicans. You can see 222 Republicans to 212 Democrats. Now, the makeup in the Senate hasn't shifted. We have, the numbers specifically have here or there, but we still have a Democratic majority in the Senate. We have 48 Democrats, but then also 3 independents who caucus with the Democrats, meaning the Democratic votes are generally about 51 to 49 Republicans. So what that means is we have a split government, which, as you may know, within a split government means that less usually happens, because things the House wants to do, the Senate might not want to do. Things the Senate wants to do, the House might not want to do. And then, oh, by the way, the president has to sign off on all of it. And whereas he might actually agree perhaps more with the Senate and Senate Democrats and what they're doing, it doesn't appear, at least as of now, there's a ton of agreement between President Biden, the Senate, and with their Republican counterparts over in the House. Nonetheless, there is still a lot of bipartisanship that may happen. There's still a lot of bills that have to pass. We're going to go over one of those a little bit later on air travel. And that means that we still have many opportunities in front of us, all to be working together to be passing a number of pieces of legislation that will be impactful for our community. And not only legislation, also some regulatory opportunities in front of us with the administration to really make a difference for our community. So why don't we move 1 slide forward? And I'm just going to give you a brief overview before I turn it to my colleagues, Joel and Michael, to talk about our advocacy priorities for 2023. So within access to care, you can see we have a lot going on. We're going to continue our work on newborn screening. We're going to be working on efforts pertaining to obtaining genetic medicine as well as diagnoses. And we'll continue our access to care, including home and community-based services efforts in 2023. And again, Joel's going to say a whole lot more on that. Within our empowerment and independence portfolio, which is our lead, Michael Lewis, will be talking a little bit more about here in a few minutes. A big priority will be on accessible air travel, but not just accessible air travel for 2023. We're also going to continue to work our efforts to expand employment opportunities for the community, on expanding economic independence and security, and not just opportunities for employment, also opportunities for education. As we know, there are barriers still for those with neuromuscular diseases in seeking and obtaining the education they may be pursuing. And then finally, within accelerating therapeutic development, we passed all those bills last year I told you about in a breathless 2 minutes. Now we actually have to implement them. And that means that MDA will be working with the FDA on that, as well as looking at the incentives currently in place for neuromuscular disease drug development within the Orphan Drug Act. And then finally, continuing to work on investments within biomedical research and really the next generation of therapies for the community, those being gene and cell-based therapies. So don't worry, I said a lot there in about 60 seconds. We're going to go in much greater detail into all of this so you know precisely what we're going to be working on within each of the bullets in front of you. Just as a reminder, you can ask questions as we go along. Go down to those three little dots over in the bottom right of your screen and click the Q&A. That's where you can find us. We'll be happy to answer questions as we go along. We'll also be taking questions at the end, probably a little both. So anytime you hear anything from us that you might have a question about, please put it in the Q&A down there. We'll be happy to answer it. So with that, Joel, I'm going to hand it over to you.
All right. Hi again, everybody. So, as usual, there's a lot going on this year in the world of access to care. So, first things first, telehealth. And as you'll see, the bullet beside that says building for the future. And what does that mean? So, as Paul mentioned in our victory slide, we did get a 2-year extension on the telehealth expansions under the public health emergency. So, all those things like being able to talk to providers across state lines without worrying about licensure and coverage under Medicaid or Medicare and things of that nature was a big win. We love that that's continuing. That does mean that there's probably going to be a little, and the reason that I call this building for the future is that this year, 2023, there will probably be a little less oxygen in the room to get a more permanent fix for those telehealth expansions this year. But in terms of this Congress, so for the next 2 years, there probably will be a lot of oxygen in the room for us to continue to get those services more permanent, especially because by the time 2024 rolls around, people will have been using these telehealth expansions for 4 years. So it'll be a lot harder for people to argue for taking them away after 4 years of solid usage. So we're really hopeful to get something passed in terms of more permanently putting these telehealth expansions in the works in this Congress, but for this year, it's probably just laying groundwork. Continuing on, we will be working on access to care for those with ALS. Specifically, we'll be starting to dip our toes into Medigap, which is essentially attempting to get people living with ALS access to the full list of services that they should be receiving. Under Medicare, there are certain services that you don't receive if you're under the age of 65, because that's its primary population, but obviously when you're diagnosed with ALS, you're automatically added to the rolls there. So trying to get people expanded access to therapies and occupational therapy and physical therapy and speech pathology and dietitians and various drugs and things of that nature. And then we have a bill specifically aimed at those kind of ancillary care services like occupational therapy and physical therapy, separate from Medigap, to just kind of give ourselves multiple bites of the apple this year in increasing access to care for those with ALS. We'll be working again on home and community-based care. So we got money follows the person in this last year. So that's the bucket of money that you can use for home and community-based care. We get a lot of investment in that, and that's great, but we still want to see it fully funded under the Centers for Medicare and Medicaid Services for everybody involved. So we'll be working on home and community-based care funding for that this year, and then also working on attempting to get better conditions for those workers that provide home and community-based care, and get more workers in home and community-based care in general. There's a pretty major shortage in those workers, so we're working on attempting to entice people into the profession as well. Newborn screening, as Paul mentioned, we got a really great victory for that last year, but the Newborn Screening Reauthorization Saves Lives Act went unreauthorized once again. So we'll be working with our broader coalition over the next 2 years to try and get that reauthorized at its full funding for this Congress. Access to devices is still relatively new for us, but we want to make sure that people are getting access to their wheelchairs and their lifts and standing wheelchair systems and seat elevation systems and things of that nature. So we'll be continuing to work on with our partners on that to try to get people increased access to those services and things as we're going forward. And we're really excited about all the work that's going to be happening with that, particularly as Paul mentioned, with the FAA reauth and getting people access to wheelchairs on planes and things of that nature as we're going forward. And then, of course, there's much more that we'll be working on as we move forward. One of the biggest ones, Mark, if you'll advance to the next slide, is our Access to Genetic Medicine campaign. So there are three, for those of you that were around last year, you'll be familiar with some of this. There are three key legislative goals that we'd like to accomplish in this Congress. First is ending the diagnostic odyssey. Excuse the tyrants on my side for just a second. Okay. As many of you doubtless know, the diagnostic odyssey can be an incredibly long and torturous process to getting people that appropriate diagnosis so that they can get the appropriate care that they need. So there are a couple of bills out there expanding access to whole genome sequencing under Medicaid to try and get people those answers more affordably and faster than they would otherwise receive them. We're also working on improving access to genetic counselor services in general by advocating to have those services covered under Medicaid to, again, just get people better access to those treatments and therapies and diagnoses as they move forward. And then finally, streamlining the process for patients to be seen by out-of-state providers under state Medicare and Medicaid plans. This kind of goes along with our telehealth work, but is nonetheless separate as we attempt to ensure that people can get access to the most appropriate care as quickly as possible.
Thanks, Joel. There is a question I feel like would fit into your area, and Omar asked it. He wants to know if we see any major changes either with Medicaid or Medicare for the neuromuscular community. You touched a little bit on the genetic medicine side, but didn't know if there's anything in your crystal ball that we might be working on with that. I know it's a large question, but I think we worked on some things like that in the past.
Yeah, so in general, CMS and the Department of Health and Human Services is always putting out regulations, changing things here or there. The biggest thing, though, probably is the Inflation Reduction Act implementation. That's only Medicare Part D, but it is going to be happening. There are going to be a lot of things happening in terms of the out-of-pocket cap and the smoothing mechanism to allow you to pay for your medications under Part D over the course of a year, things of that nature. And all of that IRA implementation will be happening over the next 2 years. So that's probably the other biggest one, but CMS is always doing something. So I'm sure there will be additional things as we move forward as well.
Thanks, Joel. We see a few questions coming in. We will have Q&A at the end. And Joe, I see your question about the airlines. We'll get to the airlines, so no worries. We have a whole slide about what we're working on with air travel, so stay tuned for that. So, all right, Joel, thank you very much.
Thanks, guys.
Paul, you're back.
All right, so we're going to move from our pillar on access to care towards our pillar on accelerating therapeutic development. And again, I see the questions coming in both through the Q&A as well through the chat. Thank you for those. Some good questions, some good points as well. I think we'll try to highlight some of those a little later in the call, certainly for those in which we haven't quite gotten to the topic as of yet. But before we do that, wanted to spend just a few minutes on our focus on accelerating therapeutic development for 2023. So as I said, last year, actually a whole suite of bills passed as part of the FDA user fee reauthorizations. FDA's user fees, in which industry pays a fee for their products to be considered by FDA, that program needs to be reauthorized every 5 years. And as part of that, that gives Congress and organizations like MDA and the biotech industry and FDA and really anybody involved the opportunity to look at what FDA is doing and everything related to FDA and say, how can we do this better? And so consequently, there were a number of bills, as I mentioned earlier, that were passed back both in September and then again in December. There were 2 different suites of bills that were passed, all trying to make the process better. So now that those actually passed, now it's time to implement them, because for those of you who follow policy, perhaps have followed us before as we talk about such matters, oftentimes the success of new laws don't rest in the laws being passed in the first place. They actually rest in the agency that implements them, as the implementation can be as the success can be totally dictated by the implementation. So let's talk about a little bit about what we're going to be working on this year. So for one, passed last year were reforms to expedited approval pathways, including to the accelerated approval pathway, to the breakthrough therapy pathway, to a handful of others. And these new changes to these pathways need to be implemented by the Food and Drug Administration. So MDA is going to be there as FDA is considering how should we implement these, and we will be there to ensure the ways in which FDA is implementing them will only benefit our community and won't have any potential harmful impact for the community. Additionally, and I'll get to this a little bit more in a second, but there were a whole host of things to implement on cell and gene therapies, in which FDA and really the entire stakeholder community knows that cell and gene therapies are our future. And so consequently, there was a number of provisions that were included in the legislation for FDA now to implement, including some ways for organizations such as ours, also community members for that matter, opportunities to participate in conversations at the Food and Drug Administration on the future of cell and gene therapies within our specific areas of expertise. There's a new program for clinical trial endpoints for rare diseases at the Food and Drug Administration. We're hopeful that we'll get to participate, the neuromuscular disease community will get to participate in that new endpoint program. In addition to that, there has been legislation passed to try to ensure diversity within clinical trials. For those of you who joined us in the fall as we were working on trying to get these FDA and clinical trial reforms passed into law at the end of the year, you know that this was one of the things we were advocating for. As I said earlier, it did indeed pass. Now we actually have to implement it. And so that means there'll be opportunities for MDA and by extension, all of you to participate in conversations at FDA on how to make clinical trials more diverse and more representative of the patient populations actually both seeking to participate in the trial as well as hopefully take the therapy if FDA approves it. There are new provisions on decentralized clinical trials, also known as being able to participate in the clinical trial from home. FDA has to put out new information and new proposals on that, so we'll be paying close attention there. And then also the next generation of patient-focused drug development was passed into law, and so FDA has to implement that as well. Now, again, these were 2 massive bills. There are many more things I'm sure we could be talking about, but in the interest of time, these are kind of the major things we're going to be working on in 2023 with the FDA to implement. So let's move on from there. And a second topic to cover is the Orphan Drug Act changes. And here, a credit to Every Life Foundation for Rare Diseases, for which I stole their beautifully developed logo. But you can see that it's the 40th anniversary of the Orphan Drug Act this year. And so consequently, there are conversations ongoing on how to strengthen the Orphan Drug Act, how to ensure that it is even stronger than it is right now in incentivizing biotechnology companies to actually develop new therapies within rare diseases. So we're going to be at the table as that conversation is happening about the tax credit that comes to companies who develop rare disease treatments, about the marketing exclusivity that's available for companies to develop a rare disease treatment, and other innovative ideas for that matter as well. So we know that conversation is going to be happening this year. Perhaps there will even be some legislation introduced. You never know. But all looking to further ensure that the incentives within the Orphan Drug Act are strong, maybe even could be stronger in certain areas. We'll continue our efforts this year on investments in biomedical research. As I said at the outset last year, we were able to obtain $2.5 billion in increases in NIH funding, increases at the FDA for rare neurodegenerative disease funding, as well as other funding streams that saw big increases in 2022. We'll continue to try to do the same thing in 2023, including for gene and cell-based therapy research and therapeutic development. So to move to the final slide within our accelerating therapeutic development portfolio, as I have already alluded to several times, you all probably are tired of me saying it, but 2023 is going to be a big year for gene and cell-based therapies in a number of different places, including, as you can see on the right side, the headline just from the end of last year, in which FDA is setting up a new super office for cell and gene therapy products. It's going to be called the Office for Therapeutic Products. So FDA is really investing their time, expertise, and capabilities in investing further in their gene and cell-based therapy work, but there's a lot still more that has to be done. As I said earlier, there's some new programs FDA will be implementing to streamline development and regulatory review for cell and gene therapies. There are still areas in which development isn't happening in which it should, and there might be commercialization issues, meaning that companies might not be seeing that they're going to be able to make a profit from a gene therapy, even if that gene therapy could be incredibly impactful on the community. There also are other reasons for why companies are or gene therapies are slow to be reaching our community, including issues with immunology, including issues with manufacturing, including issues with the viral vectors or hopefully at some point non-viral vectors that are being used. All of this will, of course, be being worked on both scientifically and clinically, but there's going to be policy conversations around these things as well. The MDA is going to be, if not only part of, and sometimes leading as well. And then finally, if we are lucky enough to have new gene therapies actually approved and brought to market, there will be potential coverage and reimbursement challenges that could accompany that. We already have one gene therapy that's available on the market today for neuromuscular diseases. That's Zolgensma for spinal muscular atrophy. But we might actually have at least one more within a short time frame, as FDA is right now considering a gene therapy for Duchenne muscular dystrophy, for which there's a deadline FDA has to potentially approve by the end of May of this year. And then there are other gene therapies in the pipeline for Pompe disease and for ALS and for Friedreich ataxia and for limb-girdle muscular dystrophy and others. And all of these are in some ways kind of within the process in which the policy decisions made this year on these gene therapies could be very impactful on their future. So as you can hear, it's going to be a big year in 2023 for cell and gene therapies, and MDA is going to be there at the table throughout for the conversation. So that's all I had prepared to say. Mark, do we have any questions that we want to take
Yeah,
right now?
actually, if you don't mind looking at a couple of the questions in the box, and see if you want to answer some of them, Paul. As he does that, if you put a couple questions in the chat, we know it's confusing between chat and Q&A. We're trying to answering both. If you put some in the chat box, Joel has been trying to answer some of those for you. So make sure you check that out to see if Joel have answered them for you. But yeah, there are a couple in the Q&A box if you want to address a few, Paul.
Yeah, absolutely. Thank you for the heads up, Mark. So I see, Crystal, you posed a question on the FDA patient input opportunities that were discussed in a panel that I was part of last year. If I'm remembering correctly, these are the opportunities for patients and patient organizations to participate in FDA programs to deliver the patient voice to the reviewers at the FDA so that those making decisions at the FDA truly know what the community would be looking for within a new therapy. So those opportunities remain. Those include holding an externally led patient-focused drug development meeting. MDA held one just about 2 years ago on Pompe disease, and there continue to be others within neuromuscular diseases, including some just last year, especially one on limb-girdle muscular dystrophy. There are also patient listening sessions opportunities. There was actually one held just about a week or two ago on hereditary ALS, I believe it was. So consequently, those opportunities remain. In fact, there are provisions within some of the more recent bills that have been passed that only strengthen those opportunities or reiterate those opportunities, I guess you could say. Congress reiterating to FDA to say, keep up the good work on those, I guess. So that means that those opportunities remain, and that we at MDA, of course, will continue to look at those for opportunities, but also for any community members who might want to come to talk to us with ideas on that, that we're happy to have those conversations as well on opportunities for you all to be interacting with Food and Drug Administration. Mark, I see Martin's question as well. Something needs to be done for trials for Duchenne muscular dystrophy for ambulatory children and people who are on steroids. That's a very good point, Martin. It's a very good question in the sense that you're posing. And I think at the heart of that, you're saying that clinical trials are oftentimes too narrow. The eligibility may be too narrow. And so perhaps it is only available to individuals with Duchenne who are still ambulatory, only available to individuals with Duchenne who are not on steroids, or there can be a wide variety of these eligibility criterion that biotech companies place on their clinical trials, and that oftentimes leaves lots of folks out. So consequently, actually, that clinical trial diversity provision I mentioned earlier would do some to address that, and that diversity isn't just about racial diversity or gender diversity or demographic diversity. It's also about disability diversity and trying to ensure or at least work towards having more inclusive endpoints being included within clinical trials. And then in addition to that, that rare disease clinical endpoint program that FDA is now commissioned to do to actually fund the development of new endpoints in rare diseases, that includes endpoints for perhaps non-ambulatory individuals or individuals who are older or younger or just in general who oftentimes are excluded from clinical trials, trying to ensure that new endpoints can be found so that trials can be more inclusive. So there was a lot that was started last year that's going to continue this year. And Martin, I'm interpreting your question a little bit. If I got it wrong, please tell me and we'll come back to it. But I hope that I answered that adequately. So with that, Mark, I think perhaps that we should be moving forward to Michael Lewis, who is going to give us an overview of what we're going to be doing within our empowerment and independence campaign this year. Michael, over to you. Oh, Michael, are you there? Oh, there you are. We still can't hear you, though.
Hi there, Michael Lewis, Director Disability Policy. So, here are some of the priorities that we will have related to expanding opportunities in independence, increasing employment opportunities for people with disabilities, including the Disability Employment Incentive Act, which is going to be reintroduced this year by Senator Bob Casey of Pennsylvania, improving access to higher education opportunities through legislation like the RISE Act, which will allow people with IEP to present a copy of the IEP to disability student services at university campuses in order to prove their eligibility for accommodation. As of right now, a lot of universities can require you to pay out of pocket for eligibility testing instead of just accepting your IEP or 504 plan from high school. Reforming supplemental security income by eliminating punitive rules and penalties for getting married and earning money, and ending discrimination in federally funded healthcare programs. A couple years ago, the National Council on Disability put out a report on what they call quality adjusted life years, which is a metric that some healthcare providers use to deny treatment to people with disabilities, and they recommended that that be outlawed. Members of Congress introduced the bill last year to outlaw those, and it didn't really go anywhere. So we're really hoping that in the new Congress it can be reintroduced in a bipartisan fashion and be passed. Next slide, please. And of course, our biggest issue in empowerment and independence this year will be improving the accessibility of air travel. The Federal Aviation Act is up for renewal this year, and Congress has to pass legislation to reauthorize it by September 30th of this year. So this is a must-pass bill, and it presents a great opportunity for us to get accessibility requirements included in the bill. Some of those include that we're going to be pushing for requiring hands-on training of airline personnel on how to disengage and stow power wheelchairs in the cargo hold, and also um, how to do seat transfers with people with disabilities, requiring regular maintenance and inspection of onboard wheelchairs. A lot of times we've heard stories that the onboard wheelchairs are not in proper working orders. Um, Enacting the Air Carrier Access Amendment Act, which would provide a private right of action against the airlines for violations of disability rights under the Air Carrier Access Act. Next slide. Um, Next slide, Mark. Also reauthorizing the Air Carrier Access Act Advisory Committee at the DOT, which advises the Department of Transportation on accessible air travel issues. And one thing that we are supporting that was originally proposed by a group called All Wheels Up is establishing a federal aviation agency uh, center of excellence for accessible air travel, so that we have an agency that's dedicated to improving the accessibility of air travel, which is something that, as we all know, it's been too long. Requiring the asset board to continue to study and implement requirements for onboard wheelchair securement systems. The asset board came out with a study back in October, I believe, of 2021 or 2020, I forgot right now, that said with very minor modifications and retrofitting, it is absolutely feasible to put a wheelchair securement system on existing aircraft. It would make a world of difference if people that rely on wheelchairs could just roll onto an aircraft, lock the wheels in, and never have to give up the mobility in order to fly. And then finally allowing the Department of Transportation to just 3 times the allowable civil penalty for all air carrier access act violations. We believe that this will incentivize airlines to be more careful and judicious and how they handle wheelchairs and passengers with disabilities, knowing that there can be a consequence and a very big consequence for not being careful with wheelchairs and passengers. Mark, back to you.
Thanks, Michael. Appreciate that. Lots of good comments and questions are coming in. So we're trying to answer them or save them for the end.
I
So
see
thanks.
some.
Oh no, Michael, just saying we're getting lots of good ones. So we'll wait till the end to answer them if we can.
Okay.
So thanks, Michael. But with that, Paul, I know you want to take it from here. So Paul, I'll hand it back to you.
Yeah, thanks, Mark. I just wanted to kind of add a word of conclusion in a sense to something that we're going to be working on within all three of our pillars, our access to care pillar, our accelerating therapeutic development pillar, as well as our empowerment and independence, is to ensure that we're taking a close look at all the policies that we're engaged in and ensuring that those policies or our work within those policies are going to serve a fully diverse set of communities within the neuromuscular disease community. I think too often in the past, some of the policies that have been passed by Congress, too often some regulatory initiatives that are pursued by those at regulatory agencies can be, a little bit more focused on those who are more advantaged or those who are not falling within underrepresented populations oftentimes. So we're really going to double down and make a commitment this year to ensure everything that our department's doing, really everything the organization's doing, of course, but specifically on the topics we talked about today, we'll be looking at bills, we'll be looking at regulations, we'll be looking at the things we're working on to ensure that communities that historically have been disadvantaged will no longer be disadvantaged within not only the policymaking we're doing, but the policymaking that we're participating in on Capitol Hill and regulatory agencies as well. And that's going to start, at least in part, with joining the Rare Disease Diversity Coalition, which I do believe our membership is official as of today. So you'll be hearing more from us on this, certainly. There will be a lot of initiatives that will include this really centrally this focus, but wanted to ensure that you all know in 2023 this will be a focus of ours as well. So why don't we move forward from there? And with that, Mark, I think I'm going to turn it over to you.
Excellent. Well, thanks everybody. Now that you know what we're working on, many of you have advocated with us in the past, so you know what opportunities are available. But I am looking through the participant list, and they look like there'd be some new folks, which is really great. So I'm just going to go over a few of the opportunities you have to volunteer with us to make the change that's needed. So first, if you haven't already, we encourage you to join our grassroots network. Sign up for our email list. You can do that two ways. You can go to mda.org/advocacy, or you can text MDA USA to 50457. Either of those will work. If you do that, you will then receive timely email updates from us to let you know what's going on in Congress and how your voice can be how you can raise your voice. So you get emails from us letting you know what bills we need your voice on, and you can easily take action with us that way. You can email and tweet your members of Congress through our website, which will you'll get links from us through the email list. The nice thing about our system is it automatically connects you to your lawmaker. So I know we just went through some redistricting. People have changed districts. So if you're not sure exactly who is your new representative now, that's okay. Our system makes sure that we match you up with your right member of Congress. So we do that automatically for you. In addition to emailing and tweeting your members of Congress, you can take action with the government agencies. We talked about this a few times tonight. Lots of things get done at the agency level: the Department of Transportation, CMS, FDA, Health and Human Services, and your voice can be heard that way. Last year, we had a few advocates actually testify at a Department of Transportation meeting on air travel. So we can connect you to opportunities like that as well. You can join educational webinars like you are right now, and you can share your story, which I'll get to in a second. We also have many opportunities offline as well. We're trying to get more opportunities for folks to visit their member of Congress, both in person. We're trying to bring that back again, but also virtually. The picture on your right is from our virtual Hill Day last year, where folks met with their members of Congress on important issues. You can see there that is a meeting with Senator Susan Collins of Maine. So we all have those opportunities for you. We'll give you the opportunity to call your member of Congress on issues that are important to you, write blogs and other pieces, or organize in your community. So as you can see, there's a large menu of options for you. So no matter what you're comfortable with, no matter what your experience is, we have an opportunity for you to raise your voice. But the first thing is for you to go and join our advocacy list. So we really believe that the most powerful tool in your advocacy toolbox is your story. Myself, Paul, Joel, Michael, we can go to the Hill every day, present great facts and figures and strong arguments all the time, and those are very valuable. But sometimes it's that personal story that cuts through the noise, and that's really where advocates like you shine. And we really are doubling down on on utilizing advocate stories to create change. So you can see there's a screenshot of a YouTube video series we did last year on accessible air travel, and where we're looking to take that up to the next level and have more opportunities like this. So your story is super powerful, and we need our members of Congress to hear your stories to move some of these issues over the finish line. So as before we get into Q&A, which I see a few more coming in, there's three things you can do now to help us out. First, again, if you haven't already, please sign up. Maybe you received this webinar through a friend, or you found us on social media. If this is your first time here, welcome, but please sign up with us. You can do that again two ways. You can text MDA USA to 50457, or you can go to mda.org/advocacy and sign up that way. We encourage you to visit our website, and I'll put some links to this in the chat in a second, and tell us what you're interested in. So in our main webpage, there's a survey. It's actually the image on the bottom of your screen that you can tell us what sort of topics you're interested in. This will make sure that we send you issue areas or emails about bills on the issues that you care about. So if you're interested in air travel, make sure you mark that down for us via that survey, and we'll make sure that you get everything we do on air travel and other topics as well. And then our first campaign is live for this year. It is on accessible air travel. It is by far, as Michael said, one of our top issues this year. We are starting early to make sure Congress knows that we expect them to make travel more accessible via the authorization of the FAA. So you can take action on that campaign right now. And as we go through the next couple of weeks, as bills begin to drop, as legislators begin to introduce bills, we'll have more campaigns available for you. But for now, we have started with air travel. So please go to our website and take action on air travel. And I will put that in the chat as we move on. So that is the part of our last part of our program, but we do have time for questions, and I'm going to hurry go over there to the question box in a second. But before we do, you can go to advocacy@mdausa.org. That's our email address. So if you have any questions for tonight or anything you want to know, period, that's your connection to us at MDA. Shoot us an email at advocacy@mdausa.org. You're actually emailing me personally. I check that multiple times a day. So please email us. Also, if you have any other questions about issues that you have problems with, maybe it is receiving benefits or you have questions, MDA has a resource center, and you can email them at resourcecenter@mdausa.org, and they can help you as well. A couple people had very great questions in the chat. That would be great for our resource center, so that's an option for you as well. Now with that, I'm going to start to look over and see what have come in, and I know the whole team will get ready. So Paul, I don't know if there's any questions that you've already wanted to answer, and then we can go from there.
Yeah, I see one, Mark, a good question from Kenneth in the chat about whether we coordinate with other advocacy groups on our advocacy efforts, and he cites within the ALS community, specifically the ALS Association and IMALS, as both those groups have been referencing similar priorities for themselves this year as the ones we've just listed. So Ken, or Kenneth, the answer is an emphatic yes, and we do so in a multitude of ways. On accessible air travel in particular, we're members of a coalition called the Air Carrier Access Coalition, in which we and ALS Association, IMALS, and also other groups within neuromuscular diseases such as Cure SMA and Parent Project Muscular Dystrophy, and then some non-neuromuscular disease groups all gather together to collaborate on accessible air travel priorities, both at the legislative and regulatory level. So that is just within accessible air travel. More broadly, MDA actually convenes something called the Neuromuscular Advocacy Collaborative, in which we invite all the different neuromuscular disease groups together kind of at one table to discuss how we can all work together. And sometimes that means we might be working together on air travel, maybe sometimes on genetic medicine, maybe sometimes on FDA-related matters. In fact, some of those victories that we talked about earlier in our conversation today, those were driven by collective action by the neuromuscular disease community. There were 25 groups that came together and asked for the Able Age Adjustment Act to be passed last year. There were 24 groups that came together to ask for the FDA and clinical trial reforms will be passed last year, including many of the ALS groups. So as you can hear, Kenneth, absolutely, we're very collaborative. We're always working with other groups, and we know that that's going to be some of the best ways we're going to achieve change together. Mark, are any jumping out to you that you wanted to pose?
A few have come in as we were going that I thought would be nice for us to address. The one we've heard a lot of things about difficulty understandably accessing home health care, home health aides, huge issue that we're working on. Joe, I hate to put you on the spot, but I know you can talk about this. Some of the things we might be working on or have worked on or will work on to try to address some of those problems we hear all too well.
Sure. So again, a lot of that home health aids and devices and things of that nature were covered under new funding for Money Follows the Person. So for those of you that aren't aware, Money Follows the Person essentially is this big pot of money that people can use to get their home health aids and home health care paid for. And we managed to authorize that for, I'm going to blank on the number here, Mark. I think it's $45 million over the next 3 years.
450, even better.
So there's that. But then also, like I was saying earlier, we are working on several pieces of legislation for home and community-based healthcare more generally to get those programs covered under Medicare and Medicaid services, and then again to further recruit healthcare workers to those fields so that more people can get access to those services.
Excellent. Thanks, Joel. It's a big issue for us. I want to make sure we reiterated that we are working to solve that complex but very important problem. Another thing I see, Reggie, I see you've chatted about videos that you can share on social media about the issues people have with air travel. And the answer is we have a lot. So we have lots of things you can share. If you wouldn't mind shooting us an email at advocacy@mdausa.org with that exact question, I'll email you tomorrow. There's been quite a bit that's come out that you can share, and happy to work with you on that. So the email is on your screen. Feel free to shoot us an email, and I can send you some things because unfortunately there's a lot of material out there because it's way too common. So great question, and we'll send you something. And then we did get a question from James about, and I'm not sure how we can answer this, but I want to make sure we try to at least, which is about advocating for veterans' disability and maybe VA benefits not being awarded for people who have disabilities. I know we work in lots of coalitions that deal with benefits, especially with the military, and maybe that's the road we got to go. But I just want to see if anyone on the panel might be able to answer James's question. I know Michael
Hey,
might. Go ahead.
Yeah, I can just jump in. I don't actually believe we have any initiatives planned to focus specifically on that right now, James, but it's something that we want to be paying attention to, especially if, as you're witnessing, based upon your question, it appears that some are receiving the requisite attention from the VA, including perhaps those with ALS, whereas other veterans with other rare neuromuscular diseases are not getting that same attention or the same benefits. So if this is indeed the case is playing out, we're going to definitely want to look into that and seeing if there's a role for us to play there. And if there's any more information that you want to tell us about that, again, please email us at advocacy@mdausa.org, and we'll want to look into if there's a way MDA can be helpful there. So thank you for that question.
Yeah, and then we're going a little over time, and our team will obviously stay over a couple more minutes. Oh, Michael, go right ahead if you want to answer that.
I did want to address the question of SSI benefits. There are very, very stringent income and asset limits to qualify for SSI. Even if your daughter turns 18 next month, if she is living with you and she lives rent-free, odds are she will not qualify for SSI because they view that as you financially supporting her, and therefore she doesn't need SSI benefits. It's a very convoluted and outdated system, and it's an issue that we are working on to get rid of some of the outdated ways in which the Social Security Administration count income for the purpose of eligibility. You know, if you live with your parents, they count that as getting income. Um, if you live with a roommate and your roommate pays the rent and you pay the utilities, they consider that getting free rent because the roommate did not you was paying the rent. So, like I said, it's a very outdated and convoluted system, but we are working with multiple other disability rights organizations uh, through the Consortium for Constituents with Disabilities, of which MDA is a member, to try and address that.
Thank you, Michael. We are 3 minutes over. So I'm looking at the chat. There's some great comments in here. Steve, I see your comment about leveraging our relationship with PVA. I'm assuming that's to do with the veterans benefits question. That's a fantastic suggestion. We have great friends over there, so we'll probably see what they say about that and get back to you. But I'm not seeing any more questions anymore. So with that, thank you so much for joining us today on our kickoff. Any questions you have, shoot us an email at advocacy@mdausa.org. We're here for you. Thank you for everything you've done. Thank you for everything you will do. You're a crucial part in all of our victories. Your voice is powerful. And just don't forget that your voice makes a difference. So thank you everybody for joining us, and we will see you soon. Bye, everybody.